Today I am going to discuss about the questions that has been asked in the recent FMGE exam January 2024 from the subject anatomy. So we'll discuss in this video the three questions that has been asked from the topic upper limb. So the first question that I am going to discuss, this question was from the joint. So yes, the questions of FMGE exam January 2024 from the subject anatomy. So the first question, that is from the topic joint, and the image that you can see here, this image has been given in the exam, and the questions ask about the variety of this joint. So this is a joint between the carpal and the metacarpal bone. So you can see here, this is the first metacarpal, this is the second metacarpal, this is the third, fourth, and this is the fifth metacarpal, and the carpal bone which is present here, that is the trapezium. So the joint that is present here between the first metacarpal and the carpal trapezium bone, that is the first CMC, first carpometacarpal joint, and this first carpometacarpal joint, which is a first CMC, that is joint between, yes, between which two bones? Between the trapezium, yes, the trapezium, which is a proximal, and the base of first metacarpal. Base of first metacarpal, this is a first CMC joint, which is a saddle or sailor variety of joints, which is a saddle or sailor variety of synovial joints. It is a saddle or sailor variety of synovial joint, which is a multi-axial joint, yes, which is a multi-axial joint, and which permit us in the multi-direction. So this is a multi-directional first CMC, and remaining the second, third, fourth, and fifth. So these four carpometacarpal joint, these comes under the plain variety of synovial joints. This is a plain variety of synovial joint, right? So what we have to remember? We have to remember that first carpometacarpal joint is a saddle variety of synovial joint, and remaining the second, third, fourth, and fifth carpometacarpal joints are a plain variety of synovial joint. This was the first question. The next question from the upper limb, that the question about this tendon. So we can see here this tendon, and this tendon is a tendon of which muscle? Tendon of a muscle which is known as the flexor carpi radialis. So this muscle is known as flexor carpi radialis, right? So the image has been given like that. There was an arrow and asked about the tendon of the muscle. So this is a muscle which is known as flexor carpi radialis. This muscle is muscle of the anterior compartment of the forearm, and this muscle is taking origin from this projection which is known as the medial epicondyle, which is a part of a lower part of the humerus. And this medial epicondyle, which I can feel here, this part, which is also known as common flexor origin, because most of the muscle of the anterior compartment of the forearm taking origin from this part, from the medial epicondyle. That's why it is also known as common flexor origin. So flexor carpi radialis muscle is also taking origin from this part, that is medial epicondyle, all the way it is going here, the tendon that you can see here, and this muscle is inserting into the base of the second and third metacarpal. So 80% the tendon which is inserting at the base of the second metacarpal, and approximately 20% inserting into the base of the third metacarpal. So this muscle you can see here in this image also. So this particular part is known as the medial epicondyle. Medial epicondyle, and this medial epicondyle is also known as common flexor origin, right? This muscle is taking origin here. You can see, trace this muscle, all the way. This is a central part of this muscle, and it is inserting. You can see here the tendon, and this tendon is inserting at the base of the second and base of the third metacarpal. So 80% fibers, right? Approximately 80% fiber inserting at the second, and approximately 20% fiber inserting into the third metacarpal, right? And this is a second metacarpal, right? So this muscle is known as the flexor carpi radialis muscle. What would be the action of this muscle? What would be the action, or we can say what would be the function of this muscle? So since this muscle is crossing the wrist joint, that's why it is doing the flexor movement at the wrist joint. So the main function, that is flexor movement, and it is also deviating the wrist towards the radial side, so radial deviation. So there are the two functions. Yes, the one function, that is the main function, that is the flexion, at the wrist joint, and second, that is the radial deviation, which is also known as lateral deviation, radial deviation, or we can also say the lateral deviation. So these are the two functions, lateral deviation. These are the two functions. The main primary function, that is flexion at wrist joint. Right. Okay. What would be the nerve? The nerve supply, definitely this muscle is supplying by the median nerve. So which nerve is going to supply? The median nerve is going to supply this muscle. So the next question that has been asked from this triangular depression. So during the fully extension of the thumb, there is a triangular depression that appears on the radial aspect of the hand, and this triangular depression is known as anatomical snuff box. Why the name has been given anatomical snuff box? Because the drug abuser person, they use this box for the snuffing purpose. That's why the name has been given anatomical snuff box. And you can see here this tendon is making a medial boundary of this anatomical snuff box, and this tendon, the name of this tendon has been asked in the exam, right? So this tendon is known as the tendon of a muscle which is known as the extensor pollicis longus, which is making the medial boundary of this snuff box. And this extensor pollicis longus is taking origin from the posterior aspect of the ulna, and it is inserting into the distal phalanx of the thumb, which is making the medial boundary of this anatomical snuff box. And the lateral boundary of the anatomical snuff box is by the two tendons. These muscles are extensor pollicis brevis, which is coming from the posterior aspect of the radius, and it is inserting into the base of the distal phalanx. And the another muscle, which is known as the abductor pollicis longus, which is taking origin from the posterior aspect of the radius and ulna, and it is inserting into the base of the first metacarpal. So these three tendons are basically making the boundary of the anatomical snuff box. So let's see. So you can see here the triangular depression that has been appeared when the thumb is fully extended, and this is basically medial boundary of this box. So the medial boundary is forming by the tendon of which muscle? Extensor pollicis longus, right? And the lateral boundary is by the two tendon, one which is known as the lateral boundary, which is known as the extensor pollicis brevis, and another muscle which is known as the abductor pollicis longus. So these two tendon of this muscle making the lateral boundary of this anatomical snuff box, right? So in the next image, we can see here this triangular depression that is given, that is mentioned here, and this triangular depression is basically bonding by the muscle, first muscle that you can trace here, this muscle, which is, if you trace this tendon of this muscle is present here, right? And there are two more muscles which are present here that you can see here. So these are the tendons of this muscle, abductor pollicis, abductor pollicis brevis, not abductor pollicis longus, and the extensor pollicis brevis. These two tendons are making the lateral boundary and the medial boundary by the tendon of only one muscle, which is known as the extensor pollicis longus. We can see here. The important thing about the content, you can see here the content, the main content. But before discussing the content, if there is a box, definitely we have to discuss about the floor. So the floor of this anatomical snuff box is by the bones, that is the sterloid process of the radius, base of the first metacarpal, the scaphoid bone. So these three bones are making the floor of this boundary, and there is an artery which is known as the radial artery, which is lying across the floor of this anatomical snuff box, and that you can feel here. If you put your finger here, you can feel the pulsation. So this pulsation is of the radial artery. As you know, that brachial artery at the apex of this triangular depression, that is known as the cubital fossa, it bifurcates into two parts. One artery which is going towards the ulnar side, known as the ulnar artery, and the another artery which is going towards the radial side, that is known as the radial artery. So radial artery is going towards the radius bone side, and then it enters into this box and become a content of a anatomical snuff box, right? And there are two more structures that are present within the superficial fascia of this anatomical snuff box, and the structure, one is vein and another is the nerve. So there is a vein which is known as the cephalic vein, which basically starts here, which is present here, and the superficial branch of the radial nerve. So these two structures, superficial branch of radial nerve and the cephalic veins, are present within the superficial fascia of the anatomical snuff box. Right? And clinically, the cephalic vein we use for the intravenous cannula, to put the intravenous cannula. And in this image, we can appreciate all the three content that are important. The main content, that is, yes, radial artery. We can see here this radial artery. So this is a radial artery. The another, that is the vein. We can see here, this is a cephalic vein which starts here, and there is a nerve which is superficial branch of the radial nerve. So the cephalic vein plus nerve. So these two structures are present within the superficial fascia, and the main content, which is known as the radial artery, that basically lies across the floor, right? And floor is formed by which bones? Yes, if we talk about the floor of this anatomical snuff box, this floor is by the, yes, sterloid process of the radius, the base of first metacarpal, yes, and sterloid process of the radius, base of first metacarpal, and there is another bone which is a carpal bone, that is the scaphoid. So these three structures are making the floor, and we already know about the lateral boundary and the medial boundary. So these are the three questions that has been asked in the recent exam, January 2024 FMGE. So thank you very much.